Time to take a coding break. Howdy, coding pros, and welcome back to another coding break with Tam Talk, your coding break reminder, your medical coding instructor, and more. But anyway, so on today's episode, I want to talk about what's going on in the world or the wonderful world and industry of medical coding. And again, this is based on today's time. So I want to talk about the term that I know we're going to, take it and beat it like a dead horse. And this is AI, artificial intelligence. Where are we now? What is it doing? It's still doing the same thing. It's creating automated processes in the healthcare or the medical coding industry. And so what are some of the areas that coders need to be focusing in or on for continued progression in the medical coding industry? So the three top areas that I'm seeing is auditing, compliance review, which to me I feel goes hand in hand, but there may be a difference, and I'll research that. And denial management, and this is for those who are like billing coding, and really just understanding how the denial management process works. And so again, AI is there to automate simple routine tasks that will normally performed by medical coding professionals, and it forces those medical coding professionals to review or to progress into more complex roles, again focusing on auditing, compliance review, and as well as denial management. But I want to talk about something that I researched again when I was trying to figure out what to talk about, what was going on. First, I don't know if you can hear it, but it is raining. So I'm going to try to talk over that. But one of the things, again, that I researched, like what was going on in the medical coding industry, and like I said, AI, but more so, I was looking at like what are some of the CPT codes that we need to be focusing on. What changes have AI have created in this space? And so I went to the AMA website because this topic came up. Like, there are codes for augmentative and assistive AI services. And so again, this is according to the AMA, or the American Medical Association. And they're referencing some of the AI codes that were added, and these are there to help augment the physician capabilities as well as improve patient care. These codes also support patient access to innovative technologies that assist physicians by detecting clinically relevant data that might otherwise go unnoticed, or to augment physician work by analyzing and quantifying data to produce clinically meaningful insights. So some of the examples that they use, again, I'm reading this from the AMA, is the first one is the coronary atherosclerotic plaque assessment, which is basically used to assess the severity of coronary disease, derived from augmentative software analysis of the data set from a coronary computed tomographic angiography. Right? Our next one is the perivascular fat analysis for cardiac risk. This includes two codes for non-invasive assessment of cardiac risk derived from augmentative or augmentative software analysis of perivascular fat with or without concurrent computed tomography or CT scan of the heart. And then we have our multispectral imaging for burn wounds. Again, this is assistive algorithmic classification of burn healing, for example, healing or non-healing by non-invasive multispectral imaging. We have detection of cardiac dysfunction, which is again an assistive algorithmic analysis of acoustic and electrocardiogram recording for detection of cardiac dysfunction, such as reduced ejection fraction, cardiac murmurs, and atrial fibrillation. So, as you can see, AI is becoming heavily involved in healthcare, and is actually helping your healthcare providers weed out certain diagnoses, helping them try to come up with plans to treat said diagnosis or diagnoses. And so, yeah, so the words that kept coming up as I was reading this is data, assessments, and of course I see some radiology interpretations in here. But again, assessment and data, analysis. So yeah, so it is very important. These are definitely complex. And then vascular. Vascular has always been one of those areas that was deemed to be very complex because of the vascular family, the different mappings when it comes to knowing which codes or codes to assign to a case. Let's see here. Yes, so it is very telling. These are some very complex diagnoses or complex areas to determine, like assessments and treatments. So again, your healthcare provider are using these AI technology or these AI tools to help them in assessing or coming up with their medical decision making as it relates to your diagnosis or diagnoses, like how they should go about treating you. It kind of again, these assessments kind of give them some idea of where you are in that diagnosis process, whether it's progressing, as we saw about the burn wounds, whether these wounds are healing or non-healing. It's giving them assessments. So in that case, they're able to effectively treat the problem or the diagnosis. So again, so these are some of the things we need to look at. And unfortunately, I don't have the codes. I don't see the codes here because I'm actually looking at the website now. I don't see the codes here for these augmentative and assistive AI services. So yes. So again, I'm reading this from the AMA. So you are able to go to the AMA and read it for yourself. But you see how healthcare is evolving. How technology plays a major part in healthcare and how the doctors are using it to help them treat as well as diagnose a patient. So yeah, so as far as like again what our roles are, what we should be doing, again, these are some of the complex roles that we need to be progressing towards, especially if you're trying to have a long term or have longevity in the medical coding industry. But again, you're going to be progressing into more of a compliance role, more of an audit role. So for those of you who haven't done any auditing or you lack experience in compliance or auditing roles, this is your time to go ahead and pursue that now. Get trained, get your hands wet, as well as your feet wet into these different roles, because as you can see, AI is, I would say it has already been there, but they're more aggressive about AI in the healthcare space, which means there may be more denials, maybe more or increased rates from these healthcare plans or even these healthcare facilities, and we want to make sure that we understand those I say assessments, those tools, those resources, and understand how they impact our healthcare. So yeah, so that's all that I have for this week's coding break. But as always, remember to code on. And if you have any questions or any topics you want me to discuss, please feel free to DM me or write in the comments what you would like to hear more of. So until then, remember to code on, and also remember to take your coding breaks. Toodles.